What's happening? Dave here with MTS. Going to go through how to find neutral alignment, what it is, why it's important, but in sitting, in standing, and then lying down. So inherently neutral is just a space in between full extension and full flexion. So it's defined differently depending on if you ask, PTs versus doctors versus yoga or Pilates practitioners. So inherently there's a lot of variation out there. We can give you my take and I'll tell you why we think it's important. But basically, if you're in too much hyperextension or too much hyperflexion, which would be just sitting up too tall or slouching, it puts pressure on different things and can create pain in the long run because that pressure is not distributed evenly. And so you'll overwork or underwork certain structures. And so with hyperextension, you're firing all your back muscles, you're putting a lot of load into your joints. When we're too flexed, then there's a lot of pressure on your discs and ligaments in your back. And so inherently we want to try and find that place in the middle where everything's balanced, and we use the analogy of a golf ball on a tee, right? So if everything's balanced, you don't have to work very hard and you can stay there for a long time, versus if I'm forcing a posture versus if I'm being like totally passive, then inherently I'm just hanging out on all my ligaments and muscles, so they're going to get tired. There's too much tension. And then there's also reverse, which is I'm firing everything too much, and so there's also excessive tension. So inherently, if we go through, we can roll all the way forward and backward and find somewhere in the middle. And then what we do is we just relax the tailbone, so then I'm not working my low back muscles. I can relax my chest a little bit. That'll relax a lot of the muscles in my trunk. And then we shift forward. And so once again, nice and straight, not working very hard, which is where we want you to be. That's neutral spine. It'll also strength test, load test the best. So inherently, it's the strongest position we can put you in. So once again, there's different reasons to not use this, but inherently it's what we teach so that you're not compensating all the time and not loading yourself in ways that can create more pain. So that would be neutral for sitting. Standing, similar. Right. The most common we see is as people get tired, right, they shear their hips forward like this. And so the cue we'll give people is take a big breath in, look down, which drifts your hips underneath your body. And then we bring the head up, and then you can see the weight is forward in me. I'd rather have my weight in my front than in my back, right? And so if I hang out like this, well, the weight of my upper body, putting all that load in my lower body. And so after a while, that may create some pain, depending on the person. Some people are more resilient than others. So if we can take that weight and distribute it evenly over the body, then a lot of times we'll have less pain in the long run. So once again, cue being, take a big breath in. So particularly if you're someone who does this, which is the most common one we see, right? Big breath in, look at the floor, good, breathe out, drop that tailbone, drop that chest again, so I'm not working very hard. Bring the head up, and then normally we throw some other corrections for the shoulders, head, neck, but that would be the main one that we give out, or the most common one we see. And so same thing, nice and vertical, not working very hard, right? That's where we want to be, balanced. Okay. As far as neutral for lying down and doing exercises, this is fairly debatable, but inherently what we see is people teach pelvic tilting, right? And so then you have certain camps that want to like anchor the tailbone, or certain camps where it's really flat back. So depending on, different types of yoga, Pilates, etc. What we found is that number actually varies per person. You have some people where 10% tilt is perfect and others where 80 or 90 is perfect. But I'd say 50 to 60% of people, a 40 to 50% tilt is solid. Right? So, and how do we know that? Well, we test it for strength, right? So if I have somebody tilt 10% and they test really strong, well, that's good. What most people come in and they over tilt, right? So in that 80 or 90 when they do their ab work, and then we still muscle test them and there's nothing there. And so inherently we find that 40 or 50, which is the most common, that they come in and they get a lot of activation in their lower abs, which is what we're looking for in that position. So your 80 or 90s, they get it in their upper abs and they don't feel their low abs working. And then your 10%ers often feel it in this part of their hip and thigh, and so they get a lot of like discomfort up in this area. So inherently finding which percentage of tilt activates between your belly button and your pubic bone seems to work best for us for our back pain patients, hip pain patients, as far as finding where is neutral and what gives me the best activation in my low abs. So once again, debatable. It has some variety to it, but that's the basic thing we see on a repeat basis is if we could find that amount of tilt that matches you the best, you'll actually get strong where we're trying to versus getting strong and compensating maybe upper abs or distal hip flexors, upper thigh. So those are our 3 ways to find neutral for sitting, standing, and lying down doing core work. So play with those, and we'll see you guys soon.